Okay, thank you very much for this kind introduction. Also, I would like to thank again this very honorable invitation. This is my first time in Egypt, and I am having a fascinating time. So thank you very much for this. These are my current activities. I am a former president of the Brazilian Diabetes Society, and now I also play as the vice president for the Diabetic Foot International. I don't have any conflict of interest for this presentation. And in fact, I'm going to present to you a recent research that we have performed in Brasilia, where I live, the capital of Brazil. And it is related to the screening of symptoms of autonomic neuropathy that I'm going to call SAS, in patients with diabetes, and it is a pioneer assessment for the version of this SAS. As you know, diabetic autonomic neuropathy is defined as an autonomic nervous system disorder that results from change caused by diabetes or prediabetes or other metabolic risk factors, just like a metabolic syndrome, insulin resistance, and we have to exclude all possible causes. Unfortunately, diabetic autonomic neuropathy, that I'm going to call DAN, is still a very impressive underdiagnosed diabetes complication. The most recent classification that we have got published by our dear friend Rodrigo Popbus, who is also in this research, refers to the diffuse neuropathy, and we have two main groups: the peripheral neuropathy itself, and also the autonomic. The autonomic have many manifestations, just like cardiovascular, gastrointestinal, urogenital, hypoglycemia unawareness, and abnormal pupillary function. And we're going to also focus on the pseudomotor dysfunction. DAN are due to damage to the small myelinated type C nerve fibers, and the clinical picture may vary from subclinical to very, very devastating symptomatic states, and for sure requires a specific test for diagnostic confirmation. In this cartoon, you see some of the examples. I cannot use the mouse. And when we see the motor sensory autonomic, the autonomic involves only small fibers. And the type C ones are responsible for controlling all our autonomic functions. Also, it is important to understand the innervation of the pseudomotor glands. So all the nerves come here from this thoracic and lumbar nerve cord, and they get to the second motor, which is a motor neuron. And so this parasympathetic gets close to the postganglionic ones, and from this synapse, the postganglionic goes into the area where the pseudomotor gland is, and then they make the innervation here, as you can see. So the message is the pseudomotor function is controlled by small fiber, type C small fiber. And the clinical diagnosis is very simple. You see hypohidrosis and anhidrosis when you remove the shoes of the patient. So another important message is you have to remove the shoes of the patients to see what you can find. About SAS and the pseudomotor dysfunction. The survey of autonomic symptoms, SAS, has been validated already in the US by Professor Ziliox, South Korea, and Portugal. It contains the most important autonomic domains like orthotastic adaptation, pseudomotor function, vasomotor, gastrointestinal, urinary, and sexual. These only for males, with good sensitivity and high specificity compared to other complex methods. And Neuropad is also a very simple and validated screening tool that has a very low cost, very simple to apply, and we can verify clinically this postganglion small fiber responsible for the pseudomotor function. So the survey, the SAS, contains 11 questions for women, 2 questions for males, and they score a maximum point of 11 and 12 respectively. So we just ask the patient for yes, this is the column that you see here. And when they score the person gets is equal or over 3, it means that he has already autonomic symptoms of for diabetic autonomic neuropathy, because the specificity is 9% and sensitivity is 65%. Also, we can look for the intensity in this column here. When you have the Likert scale that goes 1 to 5, the highest score for female is 55 and 60 for males. When the person reads equal over 7 points in this scale, it means that the specificity is 90% and sensibility 6%. So therefore, the cutoff point for SAS is equal or over 3, and the cutoff point for TIIS is 7. So what we did, we submitted the SAS version, original version, to the cultural and translation adaptation for the Brazilian Portuguese. I'm not going to get into details because I don't have much time, but the name of the version in Portuguese is Questionário de Sintomas Autonômicos, QSA, just like the same in Portugal. Also, for the very first time, we designed an APP specific to be used with this model. Unfortunately, I cannot show you today because of the time, and also because it's not available yet for free, but it's very, very simple. Just take 10 minutes to do everything. For the neuropart system, you see here that when you apply the adhesive to the plantar area of the foot, both feet, if it stays pink, it's because it is normal. If it goes blue and pink together, abnormal. And if it turns into blue color, it's really an abnormal result, meaning that there is pseudomotor dysfunction and the feet or foot is at risk of ulceration. We applied the neuropathy only for the questions 5, 6, and 7 when they were positive. So this is the demographic characteristics of sample. I'm not going through this in details, but I'll call the attention for the most important aspects. So the sample we had, it was 109 people over 18 years old as the cohort, and most of them were type 2 diabetes, 78%. We had more females, and also they were older than the males, like having a mean age of 54 and the males 48 years. They were not in a good control. The mean glycated hemoglobin was 7.97%. Then the duration of diabetes also high, about 14 years in terms of mean. And also over 50% of them were already taking insulin. We found something also very important because we measured this, the central abdominal central obesity, because we found a very high mean of abdominal circumference that reached here a little bit over 101 centimeters. And also 80.7% had abdominal obesity. So this is a table, a very big one. I'm going to just to take the highlights for you. It's the characteristic of when the Down symptom were present and when it was absent. So you can see here that 69.7% reached the score to have SAS positively. The median score was 4, and the most common symptoms, which were very similar to the previous studies, were dryness of the oral and ocular mucosa, and pseudomotor dysfunction as well, which was for question 5, over 40% for males, 50% for females, and question 6, because they are the most important, related to the pseudomotor function, it was over 44% and 48% for females and males. Type 2 diabetes had more presence of DAN, like 78% versus 52 among type 1 patients. So something very important that we found, the presence of DAN, again, with the score equal or over to 3, showed higher values for age, glycated hemoglobin, abdominal circumference, BMI, dyslipidemia, metabolic syndrome. And also for the TIS, the total impact score, we found that 67.9% had the score equal or above 7, which means that the intensity of the symptoms was important. And the mean score for males was 7 points and over 12 for the females. And one thing that is very important, that the highest intensity that we found was leaky urine for both females and male. According to the investigation that we did for diabetes microvascular complication, we found that neuropathy was the most important finding in terms of significance. We didn't find this for kidney disease or retinopathy. And finally, another very important finding in terms of this presence of SARS, which was the regression that we did, and we can see here that the metabolic syndrome increased the risk of DAN, excuse me, by, 10 times more. Age, each increase of 1 year also increases the chance to having DAN for 1.04, and finally for the glycated hemoglobin, 1 unit rise indicated 1.63 the chance of having DAN. About this pseudomotor dysfunction, it was present in nearly 60%, as you can see here, and the abnormal neuropathy testing, 63.07%. The patients who had peripheral neuropathy with also neuropathy test abnormal was reached 62% of the sample, which reinforces the association of DAN plus pseudomotor dysfunction and peripheral neuropathy. So in conclusion, we can say that the COVID-19 pandemics open opportunities to new technologies. And I think there will be a talk just in this session about that. And this is something very important because especially for us who live in developing countries, we have to access people who work at remote areas. In the Brazilian SAS QSA, because QSA, remember, is the Questionário de Sintomas Autonômicos in Portuguese, proved to be an easy-to-use instrument to evaluate DAN symptoms because a very high prevalence of nearly 70% was verified. Also, we found a very robust association with central obesity and metabolic syndrome, which was not studied in the previous studies. And this was a very important observation that we've got in this preliminary data for the very first time. And we have to claim attention for this phenotype for these people. 2/3 of the sample presented positive symptoms with the SAS-QSA APP and abnormal neuropathy test. This confirms the finding, improves the pseudomotor dysfunction, which is indeed also a pre-ulcerative lesion for diabetic foot, and also has been already validated for cardiovascular disease as well. So, and finally, we can say that the present pioneer assessment for diabetic autonomic neuropathy emerges as a very important strategy to circumvent the currently neglected condition in terms of diagnosis and also treatment that the diabetic autonomic neuropathy is still faced all over the world, not only in developing countries. And we believe that this shall contribute to collect data in a far larger sample in the Brazilian public health system that we call SUS, and we perhaps will do this in a very short future involving all the 5 regions in our very big country. I leave you with some photos of our very new capital. I have seen so many things here that have 3,000 years. In Brasilia, it's just 62 years old. So it's a very, very big contrast that I found here. Thank you very much for attention, and thank you very much for the invitation again.